Since the United States first recognized AIDS in 1981 and the inception of the U.S. President's Emergency Plan for AIDS Relief PEPFAR in 2003, progress has been made in medical research leading to effective treatment and better quality of life for people with the virus. But regardless of that, promotion of testing and destigmatizing the virus to achieve an AIDS-free generation must continue with dedication.
Last year alone, as the UNAIDS will tell us, about 1.2 million new infections were recorded. So we've made a lot of progress, but a lot of work still needs to be done, especially in three categories to maintain the fragile gains that we've made. Adolescent girls and young women are continuing to bear the brunt of these new infections. Children, the gaps, the inequity gaps that we need to enclose in children is huge. Key population, that is men who have sex with men, people who inject drugs, sex workers, transgenders, and people in prison continue to bear the burden.
The UN is aiming to achieve the goal of 95% of people infected to know their status, 95% on treatment, and 95% on suppression to end HIV/AIDS as a public health threat by 2030. The disease demands unwavering attention from African leaders for a world where stigma crumbles and access to care becomes an unyielding right.
Under President Reagan, we really had a struggle for those of us who were already working in AIDS, which I was at that point in time, because we didn't have political leadership. And we've learned, both in this country and in all of your countries, how important political leadership is when you have something like an epidemic. But it was 5 years before the epidemic started that the American president ever talked about AIDS in public. And we could have done so much more had we had a leader who stood up and addressed the epidemic. This was devastating to us, and we would have had far fewer deaths had we had leadership.
Globally, 2022 saw the least new HIV infections since the late 1980s and showed a 38% decline since 2010. That improvement cannot be separated from PEPFAR's support.
What has PEPFAR done in 20 years? Saved over 25 million lives, prevented 5.5 million children from being born of HIV infections. It has provided life-saving therapy to over 20 million people, has provided about 65 million HIV tests so that people can know their status, and has supported about 3 million adolescent girls and young women across mainly Africa in a comprehensive program to prevent HIV infections.
HIV/AIDS is one of the most alarming health challenges in Sierra Leone. It is estimated that over 80,000 people live with the virus. So the fight is not just a call to action, but an anthem of hope to unlock the gates for a world free from the shackles of HIV. Salivu Chornakamar, AYV News, Washington, D.C.